Well, hello, everyone. This is Dr. Amig, your friendly rheumatologist from Unabridged MD. Together, we are going to review the evidence behind rheumatologic or autoimmune-related rheumatologic disorders after COVID. This is a topic I'm very often asked to discuss. In fact, this is also a lot of reasons to come and see me in my practice. And I thought that I would share with you some of my knowledge that I've gathered over the years. It's actually been years now. And also a recent study that I really enjoyed reading. And before we start, just a big reminder that it's not even a full year. Very soon in January, we are celebrating the first year anniversary of Unabridged MD. And we are still accepting new patients, and we would love to see you if you are interested in being patient at Unabridged MD in Denver, Colorado. And I have licenses to practice medicine in Colorado, Michigan, Wisconsin, and Minnesota. And yeah, come on in and you can actually jump on a discovery call. It's currently available to you. And you can actually just go on the website and you'll see there's a little link to get your discovery call. Okay, so let's start. So I'm just going to start with a very typical story. It's a patient that came to see me who had COVID. It wasn't particularly severe, but following COVID, they developed some joint pain. The joint pain was clearly inflammatory. If you've heard me before, you know that we say that the pain is inflammatory if it's worse in the morning, associated with more than 30 minutes of morning stiffness, and that there is swelling of the joint okay? So this patient, so I've had many patients like that. I'm just giving one example. This patient comes in as inflammatory joint pain, and the primary care physician looks for rheumatoid factor and CCP, which are markers for rheumatoid arthritis, and they tell them it's positive, and they tell them, well, you need to see a rheumatologist. And so then, inflammatory arthritis, positive CCP, and rheumatoid factor, you have a diagnosis of rheumatoid arthritis. There's another case, patients with COVID did very well, had a little bit maybe more severe, but like really it doesn't matter. And they developed a rash, minor rash. They developed some joint pain as well, developed some ulcers in their mouth and in their nose, and some patchy hair loss. We have a positive ANA and a positive dsDNA. They have a diagnosis of lupus. Another one developed psoriasis as well as joint pain. So it's a diagnosis of psoriatic arthritis. You see here, we clearly are seeing in the practice of rheumatology, in my practice, this is really a personal practice in this case, that there are an association that I'm seeing between COVID and those rheumatologic disorder. And, this is an important thing when we are looking at studies, when we are doing studies. It's really important to look at what the clinicians are seeing. So we are seeing that there's COVID and then there's rheumatologic disorders, but you cannot really make a full, you cannot say, well, this is a causation. You can just say there is maybe a correlation, but is there really a causation? Okay, does COVID really is causing autoimmune disorder? Or is it just, it's so common to see COVID and it's pretty common to see those rheumatologic disorder. So is it just together, right? In my practice, this is what I say. It takes not just one hit. It usually takes 2 hits to develop a rheumatologic disorders. And the truth is that the first hit, I don't really like that term, but the first hit, that's what we call it in medicine, is, for example, that you have a family predisposition. So you have a gene, either known or unknown, that says, okay, well, you're at more risk to develop a rheumatologic disorder. The second hit usually is an environmental hit. And that can be either you smoke, and we know that smoking causes more rheumatoid arthritis, or it can be a virus. And in fact, more and more we are seeing this. So for example, there's a virus called parvovirus, which we know can cause rheumatoid arthritis. There are also some infection, bacterial infection, that can cause reactive arthritis or spondylarthropathy. I'm not going into the details, but what you're hearing here is that you have a predisposition, then you get hit by a virus or bacteria, so on, and then you can develop a rheumatologic disorder. And the truth is that there has been so many COVID cases that it's been very hard to say, oh yeah, for sure this is related or not. I tend to really listen to what my patients are saying. I do have a lot of time to discuss, what my patients are describing, because of the type of practice that I offer. And the truth is that very, very often, what I've been hearing is I've had COVID, and then following the recovery of COVID, basically I started developing joint pain, okay, or all of those other symptoms. And the truth is that if you then, have an antibody and you check the antibody and they are positive, and that, goes in conjunction with what they have, then you have to agree that this is probably a rheumatologic disorder, and it might have been triggered by COVID. What's really interesting is, because it's been so common, I think a lot of us rheumatologists who are clinicians have been wondering, is there any data to prove this? So there is no perfect proof right now. And as you know, science just keeps building upon, all the time. So at first you may just have what we call a case report. So maybe it's like a case. I remember a case report from France that I really enjoy reading, where they had this patient that had blood work that had checked for the CCP and the rheumatoid factor. And after COVID, she actually had checked, they checked the CCP as well. So the CCP is one of the antibody for rheumatoid arthritis. And what they found is that the CCP had gone up a lot. Like, I think it was, it went from 32 to 400 or something like that. It was really high. And she developed more joint pain and more symptoms of rheumatoid arthritis. And, is it possible she had early rheumatoid arthritis before COVID? Absolutely. Is it possible that COVID just triggered it and made it even worse? Absolutely. Is it a proof? No, because to really prove this, what you would need is to say, well, we're going to put all the patients, like we're going to put patients out there, we're going to give COVID to some of them, and we're not giving COVID to the other ones. And then after, 6 months, we're looking at who has COVID. So, that is not really possible. COVID is so prevalent, it's so everywhere. So you can't really see it. But now there's enough data that you can actually compare to pre-COVID, and you can actually do some studies like this. So this is not what I've recently read. I don't think we have that yet. I was looking for it and I didn't find anything like this. So what we call historical cohorts. But what there is actually quite a bit of studies that are looking cohort, like in one country, in another country, and so on. And they are looking at this. And there is a systemic review of this in a UK study in arthritis care and research, which I thought did a really good job at looking at the evidence and at looking at all of them and putting it together. So I'll put this in the notes because I think that's really interesting. And what they found is that, yeah, there is definitely some data that are showing that it seems that COVID can lead to rheumatologic disorder. And I think that is very validating for both the patients that are clearly seeing a difference, as well as the physicians, and especially the rheumatologists who have seen this as well. So the main one, basically rheumatoid arthritis, lupus, inflammatory bowel disease, and spondylarthropathy, so ankylosing spondylitis, as well as reactive arthritis. What's really, really important also is that post-COVID can also just cause reactive arthritis. Reactive arthritis is a form of inflammatory arthritis that you can have after developing an infection. And what's really cool is that in those cases, and I think it's like up to 1/3 of the patients who had COVID had a reactive arthritis, they resolve in 6 months. And the ones that don't resolve are, develop basically another type of, like we call them another type of arthritis, either spondylarthropathy or rheumatoid arthritis, and so on. So I think that that's actually really validating. That also is extremely important because that also means that we don't want to wait, and we don't want to just give Tylenol and anti-inflammatory. I think number one, it's really important that we don't just say, "Oh, this is COVID; it's going to pass. Good luck," which I've heard some physicians, or not necessarily physicians, but I've heard some people do. And I think also in the family, where as a patient, you might be like, "Oh, that's fine; it's going to go away. Like I'm fine." Well, don't wait, because the truth is that there is this concept of window of opportunity. And although there is no studies looking at specifically post-COVID treatment to prevent from reactive arthritis, like more like chronic inflammatory arthritis, there is this concept of window of opportunity in other rheumatologic disorders that are make us think, I mean, at least from my practice and my experience, that probably you want to be seen by a rheumatologist. We want to look at you. We want to see if we need to treat you. And the faster you treat, the faster you get into remission. If it's reactive arthritis, maybe we can put you at only reactive arthritis and then back off from treatment. And maybe you don't need treatment for a long time. But I think that it's really a valid and an important point of, you have joint pain, go and see a rheumatologist. I think that that's really important. Or you have symptoms that you can't really quite understand, go and see a rheumatologist. So that's, number one. And the other thing is, do some blood work. And sometimes, I keep saying this over and over, rheumatology is mostly a clinical diagnosis, but it's true, like serology, so antibodies can help us make diagnosis. And for sure, someone that's not, highly trained in rheumatology, I think that when they see antibodies, they feel so much more reassured that there is something. I will tell you, you can still have, yes, there is something without a positive antibody, and especially with post-COVID. So I'll put the note in the note, this article. I highly recommend it as reading if you like it. And if you're a nerd like me, it's a good article. There's a lot of other ones. If you are interested, just shoot me an email or let me know, and I'll be happy to share more with you. And otherwise, really, just know that the science is still evolving on this topic, and that in general, my call to action is to see a rheumatologist as soon as possible if you were to develop symptoms after COVID. So I hope you enjoyed this episode of Rheumatology 101. And again, if you are looking for a rheumatologist, or if you know someone that's looking for a rheumatologist, I'm currently accepting new patients, and I would love to see you. And I'm based in Denver, Colorado. Have a wonderful day. Take care. Bye-bye.